In this video, we'll discuss about CVC liver. First known histology of liver. Liver is the largest organ in human body. Liver have two lobes. This is right lobe of liver. This is left lobe of liver. Two lobes are separated by falciparum ligament. These two lobes are separated by falciparum ligament. So this is the normal liver, right lobe and left lobe. Right lobe are 6 times larger and comparing to left lobe. This one 6 times larger and comparing to left lobe. And there is a ligament which is separating the two lobes of that liver. So two lobes of the liver are separated by three ligament. Three ligament are separated these two lobes. Anterior ligament, they are separated by falciparum ligament. Then posterior, they are separated by legumentum venosum. Legumentum venosum. Then inferior, separated by legumentum teres. So arterially falciparum, because of this this is the arterial view. It is falciform ligament. The same liver from posteriorly, it is ligamentum venosum, and inferiorly separated from legumentum teres. So basically these are the three ligament which separated right and left lobe of that liver. Liver is covered by fine smooth layer of connective tissue. So that name is called as Gleason capsules. Entire liver is covered by smooth layer of connective tissue. That connective tissue name is called as Gleason capsule. Now coming to dual blood supply. Liver have double blood supply, portal vein and hepatic artery. In portal vein, venous blood from intestines and spleen, providing 70% of hepatic blood flow. Second one is hepatic artery. This one coming from celiac axis supply. 70% hepatic blood flow. So what is dual blood supply? All organ of the body receive pure blood from aorta. So liver is the one of the organs. So liver also receive pure blood from aorta. It is receiving pure blood from aorta. So aorta giving pure blood to the liver via hepatic artery. First supply of hepatic artery which containing pure blood to the liver, that is the first supply to the liver. So liver also receiving pure blood from aorta via artery. The name of the artery hepatic artery. Now see that gastrointestinal tract, esophagus, stomach and intestine. This is complete GIT. From GIT vein arises. These vein of the GIT goes in the liver forming portal vein. This one is the portal vein. Portal vein is the second blood supply to the liver. So liver receiving pure blood from heart via hepatic artery. Liver receiving impure blood from GIT vein, that is portal vein. So the two blood supply to the liver, that is hepatic artery and portal vein. Hepatic artery from this heart, Then portal supply from this GIT. Two things are coming, they are missing, pure and impure. Blood mixing is takes place inside liver, hepatic artery carrying pure blood. Portal vein gain this carrying in pure blood. Both blood will leave the liver via the third thing. They exit the liver by hepatic vein. Hepatic vein is also known as central vein. So it is leaving the liver and all the vein superior and inferior vena cava. The right side of the heart hepatic vein is also draining in right side of the heart via inferior vena cava, and it goes for the lungs for purification. It goes for the lungs for purification. The liver, we have cell, that cell name is called hepatocytes. Hepatocytes synthesis bile. Inside each hepatocytes, inside each cells, there is synthesis of bile. Hepatocyte synthesis bile in their cytoplasm. All the bile get collected and the bile exit from liver and go in the duodenum via bile duct. So bile is exiting from the liver. All the bile get collected and it is exit from liver via bile duct. Bile duct open and duodenum on the first part of the duodenum via ampulla of water. And this bile is helping for digestion and emulsification of fat. Now see that 4 arrows. Two things is coming, hepatic artery and portal vein. Hepatic artery pure blood, portal vein impure blood. And two things is leaving, central or hepatic vein. Then bile duct, this bile duct. Both are leaving, both are coming. So out of 4, 3 are always travel together. What are the 3 things? This hepatic artery, pulmonary vein and bile duct. These 3 things always travel together. So these 3 things always travel together. So it have that name portal triad. Surface of liver, hepatic artery enter that liver. Then hepatic artery enter the liver, portal vein also enter that liver. Liver, this bile duct only coming out of that liver, but the point of entry and exit are same. Here that point of entry and exit are same. So this point is known as hilum. This part name is called hilum in the liver. On the hilum, two things are entering and one is coming out. So hepatic artery is entering, portal vein also entering. So here dual blood supply, both are entering, so it having dual blood supply. One is pure blood from aorta, impure blood from GIT, that is the dual blood supply and entering inside the liver, and bile duct is coming out. These 3 are always travel together at that helium. So these 3 things are stick to each other. 2 things are going inside the liver. Hepatic artery will divided into the arteries. The hepatic arteries, portal vein will also divided into that branch. Hepatic artery also divided into that branch. Here branches. Portal vein after going inside the liver both divided into their branch. Hepatic artery from its own branch, portal vein from its own branch. What about that bile duct? Bile duct also forming multiple branches. All are forming branches. Multiple branches from all hepatocytes are coming and they are combining together to form by bile duct. Not only the main hepatic artery portal vein but and bile duct travel together. The branches also travel together. The three duct also travel together. The branches also travel together. Attached the diagram also. So this is known as tripad, which is always traveling together. Three things always traveling together. Tripad, not separated them. Branches also travel together. Portal triad containing bile duct, hepatic artery and portal vein. These three things considered as portal triad. Next, lobular model of liver. What is the meaning of lobular model? Lobular model, lobule is a hexagonal, like it having 6 corner. So this is the liver. Cut the liver and make a slide. See entire liver having multiple hexagons like this presentation. Entire liver like this. It have multiple hexagon. It is known as lobular model of liver. This hexagonal name is called as lobular model of liver. What is presented in this center? This is the one of the, from here we will take one of the hexagon. Center we having, this one having central vein. What is central vein? Which is not coming in portal triad. The hepatic vein. So this one is the hepatic vein only, central vein. Because it is presented in the central of that hexagon, that's why it is known as central vein. At that periphery we have triad. So triad here presented. Center of each hepatic central vein is presented. At periphery triad presented. So 6 portal triad. 6 portal triad, one center. It is the hepatic vein. This one is the hepatic vein. Triad with the hepatocytes. This triad here, hepatocytes, both are connected with hepatocytes. This one is the hepatocyte. This one is the hepatocytes. So these are the cells of liver. These are known as hepatocytes. Between two, these are like a train. They are one behind the other. They form a row which is known as traffically, like bogies of train. Traffically, like bogies of train. They are one behind other. So bogies of train, between two adjacent train. Here capillaries. This one is the capillaries. One trafficule, another one. Okay, so in here this trafficule, like a capillaries is presented. That name is called as sinusoid. These sinusoid are presented here. And that sinusoid lined by endothelial cell. So this one is lined by endothelial cell. And here macrophages also presented. That name is called as Kupper cell. So these sinusoids lined by endothelial cell. We will get macrophages also presented. This endothelial cell and the Kupper cell also presented in sinusoid, and the sinusoid is presented between two adjacent tube. Trafficulae, two adjacent trafficulae only it is presented. That space between this sinusoid, here in between, here space is presented, this space part. Okay, in between here. Okay, here only hepatocytes presented, this space is presented. That name is called as disease. That name is called as disease. It containing this disease having special cell. It have cell. That cell name is called as etocell. Etocell. This etocell is important. It will causes cirrhosis of liver. This etocell causing cirrhosis of liver. So the hepatocytes presented like here bogies. After that, this here this one capillaries is presented, sinusoid. After that, this sinusoid having endothelial cell, that name is called as endothelial and macrophages. Between here space is presented. Here space is presented. In between the cell is presented. Here that gap is presented. No, that name is called as disease. It having special type of cell. That cell name is called as etocell. Why CVC liver happen? Hepatocytes have injury due to any reason, due to alcohol, due to iron, copper, any reason, due to any reason that etocell converted into stellate cell. That etocell is converted into stellate cell. It is start forming collagen, and this collagen will result cirrhosis. So here because of any reason, okay, this etocell will converted into stellate cell. This stellate cell forming collagen. So that collagen result causes cirrhosis of liver. So in between hepatocyte bogies is presented. Bile synthesis, that one helping for bile synthesis. It will transported that biles for digestive purpose. So here bile synthesis, it will transmitted to main bile duct. Okay, that reason. Now CVC liver is enlarged because of right heart failure. What will happen if you are doing right heart failure? Where the blood will go? CVC liver result in right heart failure. Right heart failure result CVC liver. A right ventricle is not pumping, blood is not going. Okay, so it will backward from right ventricle to right auricle. From right auricle, this blood will go into in SVC IVC. From SVC IVC, the blood now it will reach to organ. Here it will reach to liver. The blood will go to liver. Liver having four vein: hepatic artery, portal vein, central vein, and bile duct. Due to the backflow of blood, where the blood is coming, it is in hepatic vein, which drain SVC IVC, and because of backflow of the blood, more amount of blood is collected in hepatic vein. Grossly nutmeg appearance. In the Hindi term Jaipal. Then here we can see that nutmeg, we can see altered red white like that. Here that CVC liver also like this red white. So if we cut liver, make slide. So one side here, this part here, center hepatic vein. Okay, so this one is the three things: bile duct, hepatic artery, pulmonary vein. Here no changes. Here rupture will happen here only. So because of backflow of blood, hepatic vein dilated, ruptured. So dilated, ruptured blood will come out. So blood will come out. These are the three things normal, no changes. Necrosis of hepatocytes. Here hemorrhage necrosis will happen. So one of the lobe, we have the central vein and 6 portal triad. Here one central vein, one portal, this one is the portal triad only. here we are focusing. So hepatic vein dilated, rupture, blood will come out. So because of that reason only here red in color. Here hepatic cell ruptured, the hepatic vein is dilated, it is ruptured, blood will come out. Portal triad is normal, this one is normal. Now some cells in the hepatocytes are connecting them. So hepatocytes which are near central vein, so the blood is coming out. It is impure blood that will cause necrosis of the hepatocytes. So the hepatocytes look red in color. That is known as because of hemorrhagic necrosis there will be look red in color. And hepatocytes which are near portal triad, fatty changes inside them. So hepatocytes inside fatty changes, it will producing yellow in color. So that is the alternate red and yellow which is giving nutmeg appearance. So central vein near hepatocytes, here that hepatocytes is present or no, in these hepatocytes undergo because of central vein undergo red in color, that hemorrhage necrosis, this one is rupturing, impure blood is coming out, it causes necrosis of these hepatocytes. Here presented that hepatocytes is present or no, that one will affected. Hepatocytes which are near to that portal triad of these hepatocytes, they are yellow in color because of fatty change. This reason for red color is hepatocytes which around the central vein, there is red in color because of hemorrhagic. Then yellow in color is because of hepatocytes near the portal triad. They are yellow color because of fatty change. So altered red and yellow color gives nutmeg appearance. So this is all about CVC liver. Thanks for watching.